Healthcare-associated infections, HAIs, are a significant cause of morbidity and mortality. But HAIs are both tragic and avoidable. This fuels our passion and innovation for creating safer environments of care. This course covers some of the common procedures used to clean patient rooms throughout North America. The procedures included here are general and based on industry best practices. They should not replace the site-specific standard operating procedures, SOPs, used in your facility. If you have any questions about specific tasks or how they're to be done, ask your supervisor. There is strong evidence that the healthcare environment, especially frequently touched surfaces, can play a role in the transmission of healthcare-associated infections. Studies have shown that germs or pathogens can live on surfaces for extended periods of time, and that cleaning and disinfection can play a key role in reducing these pathogens. Many patients who enter the hospital have weakened immune systems. This makes them more susceptible to infection. Because of this, it's very important to ensure that patient rooms are properly cleaned and disinfected each day, and rigorously cleaned and disinfected before a new patient is admitted to the room. Cleaning and disinfection will help protect both the patient and healthcare personnel. Just because a surface looks clean doesn't mean it is clean. Research has shown that frequently touched surfaces such as bed rails and controls and supply carts can play a role in contaminating the hands of healthcare personnel. Contamination of hands can lead to transmission of pathogens to other surfaces or patients. This is why the cleaning and disinfection of all the surfaces in the room, especially the frequently touched surfaces, is critical to patient safety. To protect yourself, it's important that you follow safe work practices and properly prepare before cleaning a patient room or surrounding areas. There may be pieces of equipment or surfaces in patient rooms that are cleaned by other healthcare personnel. Who has responsibility for cleaning each piece of equipment or surface should be clearly defined. It is best practice to have a procedural checklist for all healthcare personnel to ensure that all equipment and surfaces are clean. In healthcare, how you clean is as important as what you clean and how often you clean. Proper techniques help protect you and ensure a safe environment for patients. Here are some reminders on general practices in healthcare cleaning. If time is limited, focus on the highest risk areas like the patient zone first and work outward from that zone. Move around the room in a consistent pattern, either clockwise or counterclockwise, to ensure that no surfaces are missed. Work from high to low. If debris falls from a higher surface when you're cleaning it, you don't want it to recontaminate a surface that has already been cleaned. Use fresh cleaning cloths and mops in each area to be cleaned. As a cleaning cloth becomes soiled or dries out, replace it with a fresh cleaning cloth. Never re-dip a used cleaning cloth into the disinfection solution. Handle waste, soiled linen, and debris as little as possible. Use care not to compress waste and carry it away from your body. Roll soiled linen carefully to limit your exposure and risk. When cleaning or mopping large surfaces, outline the area and then use overlapping passes to ensure all the surfaces were properly cleaned. Separate dirty and clean tasks. Remove all the waste and linen, clean surfaces, and then conduct hand hygiene before conducting a clean task, such as making the bed. How to protect yourself while working in patient care areas. To protect yourself and those around you, it's important to perform hand hygiene, either washing with soap and warm water or sanitizing with an alcohol-based sanitizer before you start a task, and at any time when your hands become contaminated. Germs can be spread through direct contact with an infected person or through indirect contact with a contaminated surface. When hands become contaminated, you or your coworkers can unknowingly move germs around the environment, contaminating other surfaces or people. This is why frequent hand hygiene is so important. Protecting you, your coworkers, and patients. You should always perform hand hygiene at the start and end of a cleaning task. You should also perform hand hygiene whenever your hands become soiled or contaminated, or whenever your gloves are punctured, torn, or removed. And you should always perform hand hygiene prior to eating, drinking, smoking, or other personal care activities. It's important to conduct hand hygiene before entering and leaving patient rooms, and it's highly recommended to conduct hand hygiene before restocking supplies or making the bed. To protect you while you're doing your job, you should always wear personal protective equipment. Personal protective equipment, or PPE, refers to wearable equipment that is designed to protect you from exposure to or contact with infectious agents. There are a number of types of personal protective equipment, including gloves, gowns, face masks, respirators, goggles, and face shields. The selection of PPE is dependent on the task and the potential for exposure to blood, body fluids, or other infectious agents. It's recommended that disposable gloves be worn to protect your hands from possible contact with blood, body fluids, or other potentially infectious materials. It's also best practice to use gloves when handling cleaning chemicals or disinfectants. Gowns should be used to protect your skin and clothing when contact with blood or body fluids is anticipated. Mouth, nose, and eye protection, such as goggles, masks, and shields, are recommended when it's likely that you could be accidentally splashed or sprayed with cleaning chemicals or blood or other body fluids. Finally, it's important to always conduct hand hygiene after removing and disposing of your personal protective equipment. If you're ever unsure about which personal protective equipment is appropriate for your task, check with your supervisor. To make the selection of PPE easier, most facilities have implemented precaution strategies that outline what PPE should be donned in certain situations, depending on the risk and mode of transmission of the infectious agents. Standard precautions are the minimum infection prevention practices that apply in all settings where patient care is delivered. These practices are designed to protect you and your co-workers and prevent the spread of infection among patients. Standard precautions include hand hygiene, use of personal protective equipment, safe handling of potentially contaminated equipment or surfaces in the patient care environment, and respiratory hygiene and cough etiquette. There are other types of precautions beyond standard precautions that are designed to protect you while you work and prevent the spread of infection within the facility. These include contact precautions. These are used when patients are incontinent or have open or draining wounds. When you see this precaution sign, you should wear gloves and a gown when working in the patient's immediate environment or touching his or her belongings. Droplet precautions are used when a patient is infected with a pathogen that can be transmitted via droplets, such as respiratory viruses. When you see this precaution sign and there's a reasonable expectation you could be exposed to blood or body fluids, you should wear a face mask and goggles or a face shield when you're in close contact with the patient or his or her environment, along with gloves and a gown. Airborne precautions are used when a patient is infected with a pathogen that can be spread through the air, such as tuberculosis or chickenpox. When you see this precaution sign, you should wear a respirator when entering the room, along with gloves, gown, and goggles, or a face shield if there's a reasonable expectation you could be splashed with blood or body fluids. Prepare to clean. Before you start the cleaning process, you'll want to make sure that you have all the supplies and tools needed for cleaning patient rooms. Taking the time to properly prepare your equipment and cleaning products will save you time and make you more efficient during the cleaning process. First, check your workstation or cleaning cart to ensure that all of the cleaning tools that you will need for the job are properly placed, including wet floor signs, dusting tools, and wall washing frames and handles. Next, check your workstation or cleaning cart to ensure that it is well stocked with any consumable items, such as gloves, hand soap and sanitizer refills, towels, liners, and cleaning cloths and mops. Use a chemical dispensing system or measuring cup to properly dilute cleaning chemicals and disinfectants. The proper dilution is essential to ensure that disinfectants and cleaners work properly. Make sure that all cleaning chemicals are properly labeled. Pre-wet cleaning cloths and mops with properly diluted disinfectant solution. Some facilities prefer reusable, launderable cloths, while other facilities prefer disposable cloths. Both options are acceptable. Once these tasks are complete, you're ready to start the cleaning process. Discharge cleaning. When a patient has been discharged from a room, it's extremely important to thoroughly clean and disinfect all surfaces and medical equipment in the patient room and bathroom before a new patient is admitted to the room. Studies have shown that many pathogens and multi-drug resistant organisms can survive on surfaces for months. Further, these studies showed that a patient is at a higher risk of acquiring certain pathogens if he's admitted to a room that was previously occupied by an infected or colonized patient. Thorough cleaning of a patient room will help reduce the contamination on surfaces and equipment that could present a risk to the next patient, thereby reducing the risk of infection and improving patient outcomes. The discharge cleaning process consists of these steps. 1. Prepare. Gather supplies and prepare to enter the room. 2. Remove. Remove waste and linens as appropriate. 3. Dust. High dust all horizontal surfaces above shoulder level. 4. Special cleaning. Spot clean and conduct special cleaning tasks, such as wall washing, as needed in the room. 5. Disinfect patient care area. Disinfect the high-touch surfaces in the patient care area and the room entrance. 6. Disinfect patient bathroom. Disinfect the high-touch surfaces in the bathroom. 7. Refill. Refill disposables. 8. Make bed. Remake the bed with fresh linens. 9. Inspect. Everything addressed? Anything not working? And 10. Floor. Clean the floor in the patient room and restroom, finishing at the door. As you prepare to clean a discharged patient room, ensure that you have all needed supplies so that you can thoroughly and efficiently perform the cleaning and disinfection tasks on all surfaces and equipment in the room. Look for precaution signs to determine the appropriate personal protective equipment needed to protect yourself and others in the facility. Place the workstation or cart at the patient room door and position the wet floor sign to alert others that the room is in the process of being cleaned. Sanitize your hands and put on the appropriate personal protective equipment. Survey the room. Be alert for sharps or other hazardous objects. If you do find them, dispose of them safely as per facility policy to protect yourself and others from harm. Collect and properly bag any patient belongings or medical supplies left behind by the discharged patient and deliver them to the nursing staff for handling. Ensure that the room is in working order and that no surfaces or equipment are damaged. Report any issues to maintenance so that they can conduct repairs. Remove waste and linens. If there is any portable medical equipment left behind in the room, have it sent to central supply or sterile reprocessing per facility policy. Place basins and bedpans in the designated location for disinfection. Empty all waste receptacles, including general trash and infectious waste. Remove all linens. Remove the privacy or cubicle curtains if required per facility policy. Use a dry mop or broom and dustpan to gather any large or loose debris from the floor surfaces. Once all waste and linen have been collected, close and properly seal the containers and dispose of them per facility policy. Handle the waste containers with care. Do not compress the waste with your hands. Be sure to handle the containers from the top and carry the waste away from your body. Dust all high-touch surfaces above shoulder height. Spot clean all visible soil and marks on the walls and other low-touch surfaces. If special cleaning tasks such as wall washing are required per facility policy, complete these tasks. Use a cleaning cloth moistened with disinfectant cleaner to clean and disinfect all surfaces in the patient's room. Be sure to remove any gross soil and debris from surfaces prior to beginning the disinfection process. As cloths become soiled or dry out, discard the used cloth into the trash or soiled linen container and gather a new cloth. Use care to prevent splashing and dripping. It's important to pay special attention to environmental surfaces that are frequently touched or visibly soiled. Move around the room in a consistent pattern, either clockwise or counterclockwise, from high to low, to ensure that no surfaces are missed. Although all surfaces should be cleaned, pay special attention to the following high-touch surfaces: the room door handles and surrounds, the room light switches, computer monitors, keyboards, and carts, the bed, including rails, controls, the bed frame, the top and sides of the headboard, the top, bottom, and sides of the mattress, and the footboard, the call buttons, cords, and remotes, overbed tray tables and drawers, IV pole grab areas, bedside cabinets and other furniture, including all drawers and drawer pulls, telephones, patient and visitor chairs, wall-mounted dispensers and holders, and other medical equipment that stays in the patient room. When all of the surfaces in the patient room area have been cleaned, you should remove your gloves, sanitize your hands, and put on fresh gloves before moving on to clean the patient bathroom. As you enter the patient's bathroom, flush the toilet and plunge the bowl to remove excess water. Apply the disinfectant cleaner to the toilet bowl, seat, and wall and floor area around and behind the toilet, and allow the disinfectant to dwell while cleaning other surfaces. It's important to clean environmental surfaces that are frequently touched or visibly soiled. Move around the room in a consistent pattern, either clockwise or counterclockwise, from high to low, to ensure that no surfaces are missed. It's also best practice to clean from high to low and from cleanest to dirtiest surfaces. Toilets should be cleaned last. Use a cleaning cloth moistened with disinfectant cleaner to clean and disinfect all high-touch surfaces in the patient bathroom. Be sure to remove any gross soil and debris from surfaces prior to beginning the disinfection process. As cloths become soiled or dry out, discard the used cloth into the trash or soiled linen container and gather a new cloth. The following surfaces should be cleaned in the patient's bathroom: the bathroom door handle and surround, the bathroom light switch, the bathroom sink, faucet, and faucet handles, mirrors, vanities, and exposed plumbing, the towel and soap dispensers, showers, if present, handrails near the toilet, bathroom pull cords, the toilet flush handle, the bedpan cleaner, the wall area surrounding the toilet and toilet base, and the toilet seat and bowl. After completing the cleaning process, remove your gloves and wash your hands with soap and water or sanitize your hands and put on new gloves. Check all towel, tissue, and hand hygiene dispensers. If required, refill these dispensers. Reline the linen and waste receptacles using the proper colored liners. When you have completed all of these tasks, remove your gloves and conduct hand hygiene. Refill and restock. Check all towel and hand hygiene dispensers. If required, refill these dispensers. Reline the linen and waste receptacles using the proper colored liners. After ensuring the mattress is dry, make the patient bed with fresh linens. Replace any other linens as required. When all these steps have been completed, inspect the room to ensure that all steps have been completed and all the furniture and patient education materials have been properly placed. Make sure the patient room looks clean and presentable, and all mirrors and glass are fingerprint-free. Clean the patient room and bathroom floors using either a microfiber mop pre-wetted with cleaner or disinfectant or a small automatic scrubber. If you're using a mop, a fresh mop should be used for each patient room. Work from the far corner of the room towards the door so that you finish cleaning the floor at the room entrance. Remove all the supplies that were used to clean the patient room, properly disposing of used cleaning cloths and mops. Disinfect all the cleaning tools that were used prior to putting them back on the workstation or cart. When you've completed all of these tasks, remove your gloves and conduct hand hygiene. Notify your supervisor that the room is ready for the next patient. You have now successfully completed the cleaning and disinfection of the patient room. To recap, the discharge cleaning process consists of these steps. 1. Preparing to clean. 2. Removing waste and linen. 3. High dusting. 4. Spot cleaning and special cleaning. 5. Disinfecting the patient care area. 6. Disinfecting the bathroom. 7. Restocking supplies. 8. Making the bed. 9. Inspecting. And 10. Cleaning the floors.